Hello everybody, my name's Saffron Pinniger and I'm going to be your host for Breakout Room 2. Just so you know who I am, I'm the Head of Communications for South West London and St George's Mental Health Trust, one of the organisations that's been behind organising this summit. So really good to see everybody, lots of familiar faces, and I'm really looking forward to hearing today from our community leaders and our panellists. So before we make a start, I'm going to recap housekeeping. So I think the most important thing to say, please can you keep your microphone to mute, and unless you're speaking, of course, but we'd love to see your face, so please do keep your camera on if you feel comfortable doing so. We recommend speaker view over gallery view. So if you would like to change that, you just need to go into the top right hand corner where it says view, and there are a couple of options there: speaker view or gallery view. Speaker view will default to seeing the person speaking, which is me at the moment. And we're recording this breakout session, as we have done with our previous summit. And we will be posting it on our on the websites, the organisations involved afterwards. Now, BSL interpreters, I don't believe there's anybody in this session who does need a BSL interpreter, but what I will ask is if anybody does, please do make themselves known to my colleague Kyle. You can do that via the chat function. Kyle's just posted a message there, obviously, because it's important to be able to read what I'm saying as well as hear it. So please do follow those instructions if you do need an interpreter, or if you know of anyone who needs an interpreter. I think everyone who does is in different breakout sessions. I think probably the other thing for me to mention is if you do have any technical queries, if you think you're in the wrong breakout room, the easiest thing to do is to leave the room using the blue button, bottom right hand corner. That'll take you back to the main session, where my colleague Evelina, you can message her and she will be able to reallocate you to the right session that you want to join. So if you are in the wrong session, don't worry, you can leave this session, back to the main room, message Evelina, and Evelina will be able to put you in the right place. So I think that's all of our housekeeping done. So in preparation for this breakout session, most of you should hopefully have received what's called a plan on a page. And this plan on a page is our blueprint for developing a 2-year prevention programme, which covers all 6 ambition areas and ideas for action. You can see a link that's just been posted in the chat there, which will take you to where our plan on a page is held if you want to have a look at it. It's really exciting, some of the work that's been happening already around preventing mental health problems as a result of the Covid-19 pandemic. So this plan on a page is based on information that you've shared with us at previous summits and the resulting work of the Taskforce that's been put into place in order to action the amazing ideas and suggestions and thoughts that have come up as a result of the first summit and the huge amount of work that's taken place since. So to business, we're going to focus on 2 themes in this session today. The session will last an hour in total. And first of all, we're going to look at housing insecurity and environment. That's our first theme, which is actually called theme 3, because obviously other breakout rooms are looking at themes 1 and 2. We can look at themes 3 and 4. Theme 4 is supporting disadvantaged communities and groups. We'll have a short 5-minute break in between these 2 themes, just to give you a chance to have a quick drink, stretch your legs. We will play a video during that time as well. So if we start with theme 3, and then move on to theme 4. I'm going to ask for the screen to be shared with our theme ambition and ideas. So this shows a summary, thanks Carl, this shows a summary of ideas that we need your help with in order to improve housing security and environment in our local area. So we want to work with partners to ensure a joined up and proactive service response to reduce the negative impact of housing insecurity in the environment on mental ill health. I think we'll all agree that housing and the environment that we live in is vital to how we feel on a day-to-day basis, the place that we live in and the things that we see every day when we go out and about. So we're working with community and partner organisations to provide people with the skills and information to be able to make positive choices to support their mental health and well-being. So we'd really like to know, how do these resonate with you? Can you start to comment and give your feedback by posting in the chat function? I'd really like to hear from everyone in this group. Please could you start to let us know what you think, and while you're thinking about what you might want to say, I'd like to introduce our panelists, because what we're going to do is hear from our community leaders, their experiences, and then we're going to go to our panelists who are going to respond to some of those stories. So panelists to begin with, I'd like to welcome Anne Beasley, who is the Trust Chair for South West London and St George's. Nice to see you, Anne. We also have David Bradley, who is the Chief Executive for South London and the Maudsley, our fellow mental health trust. So welcome, David, nice to see you too. We have Ian Diamond, who is the Chief Operating Officer at Oxleas, who is our third fellow mental health trust, part of the SLP, the partnership that the three mental health trusts work together in. So welcome, Ian. I think I've seen you too. And we finally have Janet Campbell, who is a Cabinet Member for Croydon Council. Janet is the Cabinet Member for Family Health and Social Care. So welcome, Janet. And I believe Malik Gull has joined us as well as a panellist. Malik is the Director of Wandsworth Community Empowerment Network. So welcome, Malik. So we're very grateful to see you all, and I believe Siobhan McDonough, our local MP, has joined us too. So a welcome to Siobhan, who I believe is joining us as a participant today. So really, really great that you can join us. So I'll move on to our community leaders. So thinking about this, thinking about the theme of housing insecurity and environment, and I can see there's some comments already, which is fantastic. I'd like to welcome Craig Holmes, and Craig is going to talk to us in a minute as a community leader about his experiences of this theme. Craig, can I just ask you to take yourself off mute and just say a quick hi?
So Craig couldn't actually get into the meeting via Zoom, so he's on my phone. So I've got him here, and I hope that you'll be able to hear him through my phone. So Craig.
Okay, thank you. Thanks so much, Pete. I should introduce Pete Riley, who's just spoken. And Pete is a good friend of not just our trust but all of our organisations in his role with Merton Citizens, which is a really vital community group that we've done a lot of valuable work with, and we continue to work with as part of this piece of work. So I'm sorry there's been a technical problem. This is one of the joys of working with technology. But Pete, great that you've come up with a workaround. Thank you so much. What we'll do then is we will ask Craig to, via Pete and via his phone, I'm hoping we can all hear clearly, to hear from Craig, who's going to talk to us about his experiences in the community. And then what we'll do is we'll go to the panelists to start to talk about some of the things that resonate with them. And then we've got comments from people as well. So I'll try to bring all those things together. So over to you, Pete. Thanks. Let's hope this works.
Go, Craig.
Thanks there. Can I just check that everybody can hear me?
Yes, we can. Yes. That's great.
I'm overjoyed. Thank you. So I just wanted to give a brief overview of my journey that I have been on within the community. My journey of homelessness, living in the shelter and supported housing through Croydon Council and in supporting agencies. And as well as my mental health experience alongside this, which obviously is now being impacted further by COVID. So I had my own flat up to about a year ago. I was a tenant, and whilst living there, I had been dealing with depression and anxiety, and in due course stopped working and became isolated. I was obviously battling to figure out my own path. I wasn't aware at the time of places like Crisis, who I have subsequently not only been a member with, but also a volunteer and worked with them on their fundraising campaign for this year. But I wasn't aware of them back then, and obviously they couldn't help me in my situation by providing advice. And also in hindsight, looking back, my GP and the mental health workers around me didn't seem able to connect what was going on and helping me in preventing what was about to happen. So overall, it did seem very passive. So when I did become homeless, I moved into the shelter, and I had no idea what I was in for in my journey through the system either. I spent 6 weeks in Croydon Council shelter, and then moved on to supported housing, where I'm still living. And I've spent the last 9 months in the housing that I'm in. And to be fair, if I look at both the shelter and my supported housing, I quite seriously, although it sounds jokingly, did prefer being in the shelter for various reasons, which I'll obviously tap into. The shelter did have things like CCTV cameras in the hallways, and individuals had their own bathroom. Obviously, that was one example of one shelter provided. Since having moved into supported housing, where I've obviously tried to get my life back together, and in those 9 months, I have been subject to homophobic abuse. I've been robbed. I've been physically and verbally abused by those that I share with. And although I've tried to work as closely as I can with my current housing agency in reporting these instances, I am also very fully aware that I have landed myself in amongst, which I like to sometimes call, it's like being a cat thrown into a bag of cats, where you've got to try and figure your way out of the situation and work your way around it, obviously sharing with people who have their own backgrounds, their own histories. And obviously COVID has created a lot of uncertainty around one's future housing, knowing that there's probably going to be a huge wave of people requiring housing, and for whatever reasons find themselves in the shelter or homeless or into supported housing. And it's also really difficult if you're trying to focus on finding a job and fixing one's life, really in a system that's already battling. So to really just sum it all up, from my experience, people do go through the system, and people who are about to go through the system have no idea of the realities they will face on top of their own mental health issues and personal battles that they do face. For me personally, learning to look beyond the current situation and turning my experience into an ambition for personal progress is the only thing I can do. But it really comes down to hope, and it also comes down to one's own skill sets that you have. Fortunately, I have a good work background, I'm educated, I'm well-spoken, I'm level-headed, but I do really understand why people find themselves in this situation. Many people want to get out of it, but they have no idea what's coming when they are in the situation. And then there are obviously those people who are in the system who, quite frankly, couldn't be bothered to move on because that's what they feel, that that's where they should be, and they have this expectation of being given everything on a plate. It's really difficult. And how do you separate individuals who are actually going through a life change, who are battling and who are trying to pull their lives back together, when you're housing them with other people who are violent, take drugs, and really make it their business to make sure you aren't able to stand back on your own feet? And I think the summit really does aim for its aims, and the summit and what you are trying to achieve as making it urgent is really needed right now. And to listen to others and identifying the challenges that people face, as well as the system, may provide people with hope, because if they can't find hope themselves, it's really, really important that they have possibility to outreach and actually connect with people who see certain trends and certain things happening in the system and who are able to provide that hope. So finding your own individual hope is important, but also to have others supporting you and know exactly what's going on in the battling system is really, really important. So thank you for letting me be part of the summit today.
Thanks, Craig. You can't see Craig, but lots of people are clapping you and giving you a thumbs up and nodding their heads. So thank you.
Yeah, absolutely. And Craig, I'm hoping you can hear me through Pete's phone, but I just want to thank you from the bottom of my heart to share that very personal and moving story of what happened to you with a large group of people in a public place. I don't underestimate what that takes. And I think it's really important to hear this type of account, so we all really know what type of thing people are dealing with at this most challenging of times. So I know I speak for everyone when I say thank you so much. And you might not be able to see the comments, obviously, if you couldn't get into this group, but we've had some really positive comments from people, including somebody, a lady called Faith, who said how brave and insightful, and you know, I absolutely echo that. So thank you, and there's some thanks from other people too. So what I'd like to do is just to go to our panelists, really just to sort of hear their initial reaction. I think as we go through this discussion, we'll all be reacting to Craig's story. But I'd like to go first of all to Ian Diamond, just for his response. And I know Ian is also going to talk as well about the aims and purposes of this theme, housing insecurity and environment. So Ian, can I go over to you for your thoughts, please?
Yes, thank you very much, Saffron. And can I just reiterate your thanks to Craig? It was a very powerful and moving story that you told, Craig. And I think there's nothing like a personal story to bring this to life, really. And I think what I've heard from Craig really kind of cuts to why this subject is so important. I think for me and for my colleagues who are involved in trying to think about this, security of housing and a reasonable living environment is a fundamental determinant of good mental health. And I think the pandemic has served to highlight this even more, because I think the impact of certainly housing insecurity, but also all of us are probably much more aware of our environment. Both of these things have become a big aspect of the pandemic, and I think more and more people have experienced insecurity because of what's happened. If I may, in terms of what we were trying to achieve as a group and with our ambition, I think we wanted to acknowledge that these are big issues, as I've already said, and they can't necessarily be fixed overnight. But I think our hope is that certainly by working together across agencies, and again, I think Craig's story has highlighted how difficult it can be for people to navigate the system, because there are so many different aspects to it. Certainly by listening to communities, and I think today is the first step in that journey, and finding out what is important to people living in South London, that hopefully we can assist people to feel better able to respond to the challenge. And I would reiterate that point. I'm not sure that we're necessarily in a point of kind of resolving everything to do with housing and the environment, but perhaps what we can do is to help people with their response to these challenges and make it a much more navigable set of issues.
Thanks so much, Ian. That's really very much appreciated. I'd like to ask Janet Campbell now if she could just add her own response and also her view on the aims and purposes of this theme, housing insecurity and environment. Janet, can I hand over to you?
Thank you so much. When I think about this theme, I think about the end result, what the end result could look like. A system that's fit for purpose, one that can manage all types of people. You know, it's clean streets, a simple thing like clean streets. How can we get there? My feeling is that the only way we can get there is by listening to the community and getting ourselves involved. You know, I remember when my daughter was suicidal, she literally was living in a place where she could not live another day. And she sought help and was sent back home to commit what she, you know, the worst. Thankfully, she was not successful, and I had to advocate for her. What would this world be like if there were advocates for people in that situation? You know, so that's what's drive me. That's why I'm here, because I quite frankly, I know that us coming together, I was brought up with this saying, it takes a village. So us coming together, which is the reason why I'm a counsellor today, us coming together, we can achieve the inevitable. Thank you.
Thank you so much, Janet. That's incredibly moving to hear, and I'm so sorry that you've been through that time. But I'm glad that I'm so glad that things weren't as bad as they might have been. And you know, my heart really does go out to you in that situation. So I feel passionately. I'm actually a Croydon resident myself, and I feel passionately as a local person. You know, we're all local people, aren't we? But I am very much in that area with you, and all the things that you've said completely do resonate with me too. So what I'd like to do is just go over to David Bradley, Chief Executive of SLAM, and Anne, after David, our chair at South West London, just for their perspectives on why this work is important from a mental health perspective, because we're talking about lots of different issues here, aren't we? Social issues, financial issues, environment, housing, and how it relates to mental health, but we're not all experts in mental health. Many people here are experts in lots of different areas, and that's why it's so important for us to all come together with our thoughts. But from a mental health perspective, David, can I come to you, and can you talk about why you feel this work is important from a mental health perspective?
Yeah, okay, thank you, Saffron, and I'll be brief on this because I think hearing from others is really important. But it's without a doubt, we all know that housing has a significant impact on people's mental health. If you're either the issues that were raised in the chat about housing insecurity or lack of housing are some of the big issues. There's, you know, there's no question at all that that's a big impact for people. And people with mental health problems are far less likely to be homeowners and far more likely to live in unstable environments. And, you know, if we can support with housing, it can really help with issues and stop some of the demand on it. But I think what we've got to do as well is recognise that Janet said there around it, we are a village, we are lots of people. This is not, you know, what we have to get away from is, oh, what the NHS will do this. We can't do that. There are housing associations, there are community groups, there are faith groups that can all work in this area and are working in this area. And I think what we can do with this is how we work together to support that. How do we look at how we transfer some of the resources that we may have to be able to help with issues like this, and how do we get staff that are in the right place to be able to help with these things from of housing? So it is undoubtedly a massive issue, and I think we've got to look at how we provide that and work together with other organisations and work in a way that we don't create barriers around our own organisations, but we allow things to be different than what it is. But if we can get some things around getting good housing, it's a big step to helping people's mental health improve.
Absolutely, David, absolutely. I think that we'll all agree that things like housing are fundamental to how we feel. And I think if you have a mental health problem, your housing is really important to you in recovery. I think equally, it might be that you don't have a mental health problem, but if you're experiencing problems with your housing, then that could have an impact. So there's a kind of vicious cycle that maybe we might see here. I'm going to go over to Anne. Anne, our chair, would you mind just giving us your thoughts on how you think mental health is so, you know, can be so impacted by some of the issues we've been talking about today?
Thank you, Saffron. So can I just say thank you to Craig and Janet for sharing those incredibly powerful stories. And I think it was something that Craig said, it's sort of echoed by David. Having a home and having an address is fundamental in our society to being able to operate. If you don't have an address, you can't get a bank account, you find it very hard to get a job. All of the things that actually give us structure in life and help with our mental well-being. So actually having somewhere to live where you feel safe, and I think that's kind of Janet's point, isn't it? It's about where you actually feel safe is absolutely fundamental. One of the things that I think we've realized in lockdown, and this is about the suitability of where we live, is actually about access to, from our homes, access to open space. One of the things that we're doing at Springfield as we build our new hospitals is building a big public park, because people who have been confined to very small, unsuitable houses during lockdown have really struggled with their mental well-being. And I think that's something that we will, the last few months will forever change our view on how important that is to our well-being.
Completely agree, Dan. And I think that the piece of work that's going on at Springfield is vital, isn't it, to make sure that people are recovering from mental health conditions in the right environment in our wards, but also I'm really proud that we're building some new homes in the local area for families as well. Thank you so much. What I'm going to do now is I'm just going to have a look at some of the questions that have come through. The first thing I should say is I can see from the chat that some people are having trouble messaging the whole group. And I think what's happened is, and I haven't known this to happen on Zoom before, but you can see if you look at the chat function, there's an option to post. You can post to everybody. Everyone, and that should be the top option, or you can post to individual people. So if you click on where it says to, there's an option there. It'll either be a name, or if you click
on working, Saffron. There's only, so on mine, there's only you and Kyle coming up as options.
Really?
To send a message to, yeah.
That's okay.
It wasn't earlier, but yeah.
Yeah, apologies for that. I think that must be a technical glitch. So if that's the case, don't worry, because I can see your comments. But I'm sorry that you weren't able to post to everybody. So that's one of those learnings, isn't it, from this type of event? I haven't known this to happen before. So what we'll do is I will obviously I can see comments from people, so I'll be able to read them out and we'll be able to discuss them. We have had a couple of questions that came in early, actually, and I think one of them is how can councils and voluntary groups improve access to green spaces and encourage people to use them? So I think that's an interesting question there. Can I ask Janet, maybe, if we can go to you? I don't know whether you're able to let us know your thoughts on that. Not specifically to Croydon necessarily, but just generally, because I know that that's one of the things that's been raised as being really, really important, that access to green space. What are your thoughts on that, Janet?
Well, I mean, it's obviously needed. One of the things that was spoken about in our group was about allotments, and getting families to work together you know, as a way of getting people out and enjoying the space, or growing their own food and what have you. And I mean, I'm up for it. And in Croydon, we've got a big movement going on in regards to green space, environment, and so on and so forth. Yeah, what I would say is get involved, throw yourself at the council and just let your voice be heard, because actually that's really the way to go for the future. Thank you.
Thank you, Janet. That's absolutely right, and I think we've probably all seen or felt the difference that can be made when people are able to get out and exercise and get some fresh air. We had another question in advance, which was around a similar kind of issue. Really, there's lots of research suggesting that outdoor exercise, for example, walking, cycling, gardening, and contact with nature are good for mental health. But how do you persuade people who are anxious or depressed to go out and experience the benefits? Can I maybe go to Ian for that one? Ian, I don't know if you've had any thoughts at Oxleas and some of the work that you've been doing with service users there, to kind of counter that that sort of challenge around people might be anxious or depressed, and maybe some people are anxious about COVID, aren't they? You know, they don't want to go outside and risk being infected, but at the same time it can make you feel physically and mentally better to go and do some exercise. Are there any experiences that you can reflect on there?
Sure. I mean, I think probably like a lot of mental health providers, we've long thought about the link between good physical health and good mental health, and for all of us, when our mental health is low, you tend to live in your head, and I think doing something physical can be really helpful. As you say, I think getting the confidence to participate, to take those first steps can be really difficult. So certainly, as in terms of the people we work with in our services, we have programs which are focused on, you know, from simple groups, taking people out on walks if they don't feel confident to do so, through to linking in with local gyms, through to trying to do more personalised programs with individuals, so a mix of kind of group and individual work. I think it's more of a challenge, though. Obviously, where I work, we're only dealing with a segment of society, and I suppose there's a more fundamental question which would be really good to put to the group about how do we reach out to the whole community, because there are lots of people who are out there who perhaps don't have a social network, feeling isolated, aren't feeling confident, and how, a bit like Janet was saying around kind of green spaces, how do we galvanise communities to kind of look after each other and help kind of develop that confidence.
Yeah, quite right. I think those are some of the fundamental questions that we're addressing, aren't we, as part of this work. And thank you. What I'm going to do is we're actually halfway through, slightly over halfway through our breakout. So I'm going to suggest a 5-minute break. We'll play a video during that time. But if you please do take time to stretch your legs and grab a glass of water or tea or coffee or something, and let's all join again in 5 minutes time, and we will look at theme 4, the second of our 2 themes that we're looking at. In the meantime, we'll try to share some of the comments which have come in directly to us, so everybody can see them. We'll try to overcome that little technical glitch. I think I can see my colleague Carl has already been doing that. And look forward to joining you again in 5 minutes then, everybody. Thank you so much.
Matt, do you need me? Okay.
I'm really a single mom with 3 children. I don't really have any more income apart from universal credits. So COVID have affected me very badly, and emotionally, mentally, I mean, physically, financially, in all of the way.
My entire life purpose of the last 2 years came crashing down in a matter of seconds with Boris Johnson's announcement about closing schools and cancelling exams in March. Young people lost their friends, their education, their futures, the people they confide in, their escape and their distraction from everyday life, all instantaneously, and were given just 2 days for some kind of closure.
I recently had a conversation with a young woman who's a black mom, single mom, has a 6-year-old son, and lives in a house that she's been completely upset with. And I think what COVID has done in terms of my engagement with community groups is really exacerbated pre-existing issues around housing, issues around poor access to mental health services, and so forth and so on.
For me, good mental health is really all about how do we support people and families to retain a sense of well-being and positivity and optimism about the future, and that's going to vary enormously depending on individuals and their circumstances and the challenges that they're facing. And of course it also has to mean being there when things feel just too difficult and too challenging, and when problems are starting to develop before they get so bad that they push people into crisis.
I'm supporting this program to protect our community's mental health because Covid-19 pandemic brings all types of feelings, from loneliness, mood swings, anxiety. We all need somebody. Reach out to family, friends, people like us. We're here to help you.
Hi, I'm Ellie from PACT, and I am supporting this program to protect our community's mental health because the pandemic has exacerbated many of the challenges that were already being faced by families in our communities. This is a great opportunity to better understand how we can support the most vulnerable and enable them to access services that are relevant to them.
We are working together to help protect our communities during the pandemic. In this summit, we'll help to shape our vital plans.
Hi, I'm Priya. I work for the Maudsley charity. Good mental health to me is maintaining a balanced attitude, a balanced approach, not to get too swayed by what's happening outside, what's going on in the country, in the world, to think that we are all in this together and we have to get out of this together.
Hello, I'm Chris Best. I'm the Deputy Mayor for Lawishon and the Cabinet Member for Health and Adult Social Care. I've just been amazed at the work going into this programme. It is so important, and I believe that every resident should receive the help and support they need, and we must work together to make this a reality.
Hello, my name's Layla from PACT, and I'm supporting this project because I think good mental health is the cornerstone of a healthy society.
This summit is important because it's bringing stakeholders and communities across South London together to focus on promoting and protecting mental health, a topic which is often stigmatised. So giving people the chance to come together and not only openly discuss, but to have a say and help shape the future of mental health in their communities is something we should all be doing.
I find that hearing and reading about the way other people have navigated their way through mental difficulty and distress, as I do every day here at Bethlehem Museum of the Mind, is really good for my own well-being.
Hi, my name's Minnie and I'm from Parents and Communities Together, and I support this project because the first time we went into lockdown, we were just surviving and we forgot about key important things like mental health, and it's important that we don't do that now.
Okay, thank you so much, everybody, for your attention so far. So I'm just going to move on now to our next community leaders. So we're going to talk about how we're going to talk now about supporting disadvantaged communities and groups. and we're going to be joined by community leaders Laura Marziale, Rebecca Hozale, and Fatia. I'm really sorry if I might have pronounced some of those names slightly incorrectly. You have to correct me. I'm sure I have done. But we're really glad of your time today. We're going to be hearing from panelists, including Jackie Dyer, who's the Mental Health Equalities Advisor from NHS England, Ranti Larumi, who's the lead of the Evolve Network at South West London and St George's, and Malik Gull, who's the Director of Wandsworth Community Empowerment Network. So first of all, can we go over to Laura? Really love to hear from you, Laura.
Thank you so much. Can you all hear me okay?
Yes, we can.
Good afternoon.
Yes,
my name. Thank you. So my name is Laura. I'm the founder and director of a small organization called Creating Ground. We use the arts and collaborative projects to bring people together, improve well-being, and create change at a personal and community level. We mainly work with women, migrant women, majority of whom experience disadvantage on a daily basis, either because of their immigration status, their living conditions, their family income, their migration history and background, the general hostile environment we live in, and or because of not knowing about services or not being able to access them. What has supported our group during lockdown has been to be able to continue to meet via Zoom, to have been able to share and learn together, have someone to talk to know that we were not alone, that we were there for each other, to have had a common purpose. It was a combination of emotional and practical support, and this has been essential for our mental health. Unfortunately, this has not been the reality for many other people we know from our own migrant communities. For example, those who don't have access to internet or to a network of support, for those who have seen their supporting organizations closed, have found themselves with their children in a very confined and not comfortable space, those who don't speak the language, and those who have no recourse to public funds, those who have felt in despair and hopeless, and those whose vulnerable conditions have been exacerbated by the virus. COVID-19 has affected all of us, but some communities have been disproportionately affected. The gap has widened and is widening further and fast. We are so grateful to the Taskforce for suggesting this as a theme. What I personally welcome most is the willingness and desire to be innovative, to listen to our communities and co-produce with us. Co-production is so important. Co-production is vital for change, for effective and long-lasting change. Solutions have to be found together with and not for people. And it's so important to find culturally appropriate ways and tools to reach and engage those communities who for different reasons may be unaware, unable, or uncomfortable accessing support. And this summit is definitely giving us lots of hope and encouragement. I'm now pleased to introduce Rebecca and Fatia from South London Refugee Association. So Rebecca, over to you now.
Thank you so much, Laura. My name is Rebecca and I work for the South London Refugee Association. And we're working with all migrants, refugees and asylum seekers who are in crisis or at risk across South London. And our communities are facing a lot of the same issues that Laura just described really well: constant insecurity and inappropriate housing and support levels. And we see how this impacts on people's mental health on a daily basis. And I now want to hand over to Fatia, who is a really active member of our women group with whom we were meeting every week on Zoom throughout the whole lockdown since March now. These group sessions have been an incredible source of emotional support for all of us throughout this challenging time. And yeah, I'm looking forward to hearing from Fatia. Thank you.
Thank you, Rebecca. Hi, everyone. I'm really happy to join you all today. So my name is Fatiha. I'm an asylum seeker. The COVID-19 pandemic really worsened the situation of many of the refugees and migrants who already before had many problems, Me and my husband and my daughter were moved from accommodation to accommodation. We now share one hotel room without a kitchen, and it's really difficult. And our situation really impacts on our mental health. It is difficult to access support, and there are many barriers. So it's really hard and it's insecure. And I will now share with you a poem I wrote about these hard times and my experiences. So I want to live without fear. I'm a migrant. I feel isolated. I need someone to understand me and hear my voice. I want to combat my loneliness and join a safe place. Sometimes I feel very upset and that I have lost all my ways. And often I feel useless and that I can't leave behind me any trace. I need to change myself. Perhaps I will have a new change. I'm a travel agent. I cannot work. I cannot travel or even meet people face to face. Sometimes I'm wondering, is this the end of my living days? I said to myself, no. You have to stay strong and someone should hear your voice. I'm trying to travel through my mind with others and share my views. I want to discover new cultures, languages, new people, even only by my eyes. The feeling to be encouraged, heard, is like to forget that you are living in an empty space. UK is my home of safety. What I hope is to give me a new chance. I fled from problems, fears, and all what I need is a safe place. We are all human beings, all equal, and we all deserve to live in peace. One day, everything in this earth will collapse, and we need only to ask for grace. I hope this is just a dream and not a real fear. I'm sorry, and thank you so much.
Thank you so much, Fatia. Thank you. And I'm sure you can probably see people are applauding you via Zoom. Really appreciate you sharing that with us, your very personal experiences and a poem that you've written as well, which was really, I think, very emotive and describes very eloquently how you're feeling at this time. So I think we're all very aware that there are groups in our community that we're all a member of the community, and we're side by side with people who might be in groups which are more adversely impacted by COVID than others. And part of the work that we're doing is to try to look at how those challenges are being experienced and what we can do about them. So what I'd like to do is I'd like to go to Jackie Dyer first of all, and just hear Jackie's reaction to some of the accounts that we've just heard, and for Jackie's thoughts really on this theme. So over to you, Jackie. I'm hoping that Jackie is still in this group.
I'm here. Can you hear me?
Hello, Jackie. I can hear you. Great. Thank you.
It's great actually hearing from our fellow human beings about some of the challenges that they're experiencing in terms of the impact of COVID. So it's really good to hear from that lived experience. And clearly it's really important that we support all our community members, but in particular those that are disproportionately impacted, which is why this theme is very much present here. And I'm hopeful that the work that we do from this theme in terms of our action plan will help for those groups in particular. And I think that there is this sort of understanding that I think that we really do need to have, that these are groups that are already experiencing disproportionalities and ongoing crisis. In the first instance, this is not new. This is another level of crisis on top of that which people are experiencing. So I think it's, so when you look at sort of like housing and access to employment, access to good housing, access to education, some of the things that were mentioned from the last speaker in terms of being able to feel safe and to be able to flourish and to live a peaceful life. These are things that everybody wants as human beings, but for some communities, they are less likely to get them than their counterparts. And I think that we've got a responsibility to attend to some of these groups experiencing these disproportionalities and this disadvantage via this, via the work of the summit and the task force. So I look forward to that collective work that we will be driving forward to that regard. But I think there's so much already articulated by the speakers, it's very difficult to add any further about the urgency of attending to
attitudes.
So
they are, and therefore mute me constantly.
Can I just ask
I'd rather you didn't.
Sorry, can I just ask, if you're not a speaker, would everyone mind just muting their microphones? Sorry, that would be really handy. And Carl, I don't know if you're able to mute people who aren't speaking. Jackie, sorry, I think you were back over to you there.
I just think it's really great that we're here having this collective conversation to sort of, in a way, sort of continue to cultivate the good work that's already been done at a very grassroots level and to support and harness that. I'm very clear that there's a whole range of really great work that's taking place, and how do we collectively look to support that, particularly for groups that experience disadvantage and so forth. So it's great.
Thank you, Jackie. That's fantastic. And I think you're absolutely right. And I hadn't really thought about it in this way before, but kind of, I think for some groups who are disadvantaged, COVID has kind of added a level of crisis on top of existing crisis. And actually for some people, there might be several different layers of crisis in their lives that they're experiencing all at once. And that's really important to remember, isn't it, when we think about some of the people that we live in our society with and we want to support. So I'm going to ask, I'm going to go see if Malik is able to give his perspective. Malik Gale, who is the Director of Wandsworth Community Empowerment Network. Malik, are you with our group? Hello.
Yes, thank you, Saffron. Thank you. I'm very pleased to be here. I just want to really build a little bit on what Jackie said and on the contributions that our colleagues have made. First of all, I'm a bit uncomfortable with the word disadvantaged groups, because while these groups and communities, our communities, do experience some disadvantages, structural disadvantages, which are not of their fault, they are also groups of rich abundance. We heard the poem shared, very moving poem shared earlier on, and there's culture, tradition, song, memory in all of these communities, and we should celebrate the assets and cultural contributions that they make to our society. And I suppose, just building on what Jackie has said, I think one of the things that I'm frustrated about is that a lot of the issues that have been raised by our friends at South London Refugee Association and elsewhere, these are things that we've known for the last 20 or 30 years. This is not something that is new. And I think one of the things that we should do through this work at the summit and elsewhere through our institutions is start to shift resources into communities who are already doing the work. I'm very uncomfortable about exercises to do more scoping and more mapping and more listening, because how much more listening and scoping and mapping must we do? So it's absolutely central. These groups we already know where these groups exist. We know the churches, the mosques, the temples, the neighborhood groups, the community associations. We have mapped these communities to death. And I think one of the things we now need to do is start moving towards operationalizing resources into these communities and investing in these communities so they can bring their abundance and their richness into a wider civic society. So my message really, my contribution really is that we need to move away from these endless processes of mapping and scoping and needs assessment and listening and summits and conferences and so on and so forth, and actually start putting in plans to genuinely shift resources out of our institutions and into communities. What is the operational plan? That is my question. What is the operational plan, which I think we need to take back?
Yeah, I entirely support that, because I don't think that disadvantage is an appropriate term in this kind of context. I think it's marginalised, and it's not, you know, not marginalised of their own accord. It's marginalised because there are structural inequalities there. So, whilst we know that, you know, COVID is going to increase mental health need, because something like 10% of people who get it suffer from long-term problems, that's going to be something which is just going to be super added into all of the marginalisation which there already is there, because those are the groups which are most likely to be affected by COVID. So it's just something which adds to the problem in terms of mental health needs and creating them. And what's needed is actual real solutions rather than any further mapping, because the data's already there, and we know that Black, Asian, ethnic minority communities are going to be more affected by COVID than other communities. So we need something which is operational and real to meet the needs. We need money spent in the communities in ways that it hasn't been before, I think.
Thank you so much, Bruno, and thank you, Malik, as well, for your thoughts and your passion there. I really do appreciate that, and I think we're all in agreement that there is an absolute urgent need to take action. I think that's something that we're all absolutely on the same page about. What I'm going to do now is just move on to some of the questions that we've had in. And I think maybe I might go to Jackie with this first one. I'd like to think about what are the steps taken to tackle deepening inequality. Jackie, I don't know if you could sort of have give us your perspective there on the sort of deepening inequalities behind some of the groups in our society, which, you know, obviously is an important question as well around language as well, isn't there? So thank you for your comments, Bruno and Malik, on that. Jackie, any thoughts there?
Yeah. I sort of want to clarify the use of the terminology, because I think if people it's actually really important to listen. So if you listen, you will hear people phrase the term disadvantage and use it differently. So I'm very clear that when I use that term, for example, that I speak of communities that experience disadvantage, not disadvantaged communities. Therefore, the former refers to the structural nature of these challenges that people have that create a lot of the crisis that they experience across the system. So I do believe that we need action. I really do, but I also think that we have to have informed action. So I think that action goes closely to responding to what the data, both in terms of what people are sharing from their lived experience and what the actual numbers are sort of like saying. So for example, I know that in the borough that I'm based in, the effort to really focus on inequalities actually has emerged further by collecting and paying close attention to both people's lived experience and the data. That enables us to be very focused in where we target, right? So in terms of attending to increased attention to provide employment and skills opportunities for people who are impacted by COVID, i.e. the rising levels of people on universal credit, the rising level of numbers of people from certain groups that according to their ages, that have dropped out of business, have not been able to sustain their employment, that are now taking particular benefits. With that data, you are able to target those communities with the solutions and the responses that are needed. And you can co-produce that response with the voluntary sector, the community stakeholders. So you take a collective, collaborative approach, which is actually informed both qualitatively and in terms of the numbers. That then enables you to be really quite agile in looking at whether or not the transformations are actually really being made through one's efforts. So I think that it's really important to continue with the sort of co-productive, collaborative kind of like approach, but to make sure that it's also informed by what does the data actually say around these inequalities. I was actually at a meeting earlier on today, and that meeting around international, national, and regional data around COVID, when you look at it in terms of through the lens of ethnicity, through the lens of gender, when you look at it through the lens of age, you see very different trends and patterns that if you just said, oh, we're going to look at groups that experience structural inequalities alone, actually you might not be able to attend to or see. So it's that kind of thing that for me is also really important if we are really looking at addressing deepening inequalities. Because remember, the purpose of this task force is a response to the impact of COVID on people's mental health and well-being. So that means we have to look at it systemically in terms of the impact in terms of one's economics, access to finances, housing, employment, education, right across the age range, right across ethnicities, right across migration status, and these kind of intersectionalities and the data and the experiences through listening help us to co-produce a better response and solution than what might otherwise be gained.
Thank you so much, Jackie. That's much appreciated. I'm going to ask whether Ranti has been able to join the meeting. I know that there are a couple of technical issues. Ranti, have you been able to rejoin by any chance? I think Ranti might not be able to, which is a shame. So what I'm going to do, I'm conscious of time, we've got a couple of minutes left, and I'm going to ask David Bradley, Chief Executive of SLAM, whether you're able just it's sort of in about 30 seconds or so, David, just give us a clue as to some of the work that trusts can do to support carers. That's another question that we've had. Are you able to kind of give us a bit of a flavour of how mental health trusts, what we can do during this time to step up that important work of carers?
So I think the theme from this, and perhaps if I'm not addressing that, I think what we're hearing from a lot of people is we need to take some action on this. We have lots of talking around things, but there's things that we can do. And when we say, oh, well, what could mental health trusts do to support carers? I think I would rather say, what can we do to help other groups to support carers? Because there are far more skills and knowledge around some of these things that local communities have rather than us. So I would, building on what Jackie said and Malik and Bruno and others around, well, what do we actually do now to shift some resource and some not capability, because people are capable around things, but actually shifting some things to be able to get some support a lot of these services that we've got out there. And I'm reading in some of the comments, some of the really good stuff that's out there. And I can see a lot of these groups on the brink of collapse because of what's happening in society at the moment.
Understood. Thank you so much, David. Quite understood. So we only have a few more seconds really left in our group. I want to thank all of our community leaders, all of our panelists. Carl, if you could just share the survey and the link, and then if people are able to just spend a few minutes giving us their feedback. We're going to be joining the main room very shortly, so thank you so much for everyone's contribution, and look forward to joining